Scene 1. Patient visits the doctor's office. Oh, gosh. Hello. How can I help you today? Well, I haven't been feeling well the last couple of days. I could barely sleep last night. I just couldn't stop coughing. What are your other symptoms? Well, I have a sore throat, stuffy nose, and body ache. I'm so tired. I had a fever of 102 last night. I just don't know how to get over this. I feel so drained. Any vomiting or diarrhea? I did vomit after eating soup yesterday. I can't keep anything down, but no diarrhea. Sounds like you're experiencing common flu symptoms. I would like to listen to your lungs to see if you're congested. Take deep breaths. Yep, just what I thought. You definitely have the flu virus. Oh no! How do I get rid of the flu? Well, typically, just drink lots of fluids to keep hydrated and maybe take pain reliever for body ache. Okay, is there any way I can prevent myself from getting the flu in the near future? Absolutely. This is why every year in the beginning of the flu season, we advise our patients to always try and get their flu shots right away. At least you have a better chance fighting off the flu by building your immune system against the virus. Doctor, can you explain to me what exactly is a flu virus? Sure. The flu virus, scientifically known as influenza, is a very contagious respiratory infection accompanied with most of the other symptoms that you are experiencing, which is caused by influenza virus. How did I get this virus? Well, have you been around anyone that is sick with similar symptoms as you? Now I think of it, my sister was sick last week with a really bad cough and fever. Well, if you've been around her, then it is more likely that you caught the flu from your sister. But how? She never coughed on me. Influenza or the flu can enter the body through mucous membranes in the mouth, eyes, or nose. So if a person is sick with the flu and they cough or sneeze, the flu virus becomes airborne. You can also contract the flu if you touch a contaminated surface like doorknobs and phones or pretty much anything that infected people touch. What happens if you just so happen to touch something contaminated, you will likely touch your nose, mouth, eyes, without realizing that the virus was on your hands. Wow, now I see why I got sick. Thanks, doctor.
Scene 2. Defense Officer Educational Segment.
You have to be extra vigilant because sometimes the flu contagion is something even more powerful and dangerous.
What are you looking at?
Nothing. What's that, folks? You want to know about the flu virus? Okay, the flu virus is made up of 3 basic types of viruses, A, B, and C. When there's a mutation or a rearrangement of certain genes in the virus subtypes A, B, or C, then the result is antigenic drift.
Yeah, flu viruses like me are able to change from season to season because of antigenic drift.
What is antigenic drift, you ask? Well, let's take a look.
Why don't you tell them about mutations?
You're right. What's your name, sir?
My name? My name? Well, that's not important right now. Tell the people how new strains of the flu virus are created. You know, the strains that have never been seen before.
Mutations can result in progeny viruses that contain genes from strains that currently infect people. This leads to the creation of new strains of the flu virus that have never been seen before. As in all viruses, the genome is encased in a capsid consisting of protein. The influenza A capsid contains antigenic glycoproteins, glutamine, and neuraminidase. It takes hundreds of these molecules to form a capsid. These protein parts are recognized as formed by the immune system, which generates an immune response to the invader. There are many forms of these subtypes of influenza have been infected or even if they are vaccinated for the past flu viruses.
Both humans and animals alike can be infected or serve as reservoirs for viruses like me. For example, flu virus outbreaks have been found in poultry, pigs, horses, seals, and camels.
Did you say you were a flu virus?
Oh no!
Anyways, as I was saying, all the subtypes from H1, 2, and 3, N1, and 2 cause epidemics in humans. Did you know that the flu strains are named for their subtypes H, A, and NA, also at the location where the flu originated, the year of the isolation of the strain number? Interesting stuff, huh? Unfortunately, most influenza viruses go undetected by medical doctors, which is why it is very important to get a flu shot every year so we can avoid the flu epidemic.
Scene 3. The boss battle.
Hey there,
Hey,
you from around here?
sorta.
You look familiar. Do I know you?
No, I don't think so.
The flu virus, I knew it.
You'll never beat me.
Whew, that was tough. Let's not be too confident though. Flu viruses change. And fast.
1 year later. Wow! Soon I shall